what would happen if someone is coming to me for an art therapy session, the answer would be that, they have to come with a mind of a child. They have to be open minded, because a lot of times what happens is that people think that, they're going to instantly heal, or they have the misconception that, just because they have a paper and a pencil and then they can just draw, they are going to give art therapy to themselves. So art therapy doesn't work like that, because we have examples in history where we have a famous artist, Vincent van Gogh, who himself had a lot of issues mentally speaking. He didn't heal as such, because he didn't know about any better. But he was very good in arts. So being very good in arts and then using it to, self-treat yourself is not going to work. It is very much of an important requirement to have a therapist with you. Now, what to expect when you are going for a therapy is to, your energies, your subconscious is cleansed by the art therapist through the modalities of art. It could be various art forms that are chosen by me, or any art therapist you're working with who's professionally trained and qualified. They may just use either, drumming, or they may choose, they may just choose that you have to draw a certain picture or visualize a certain thing, which will help you to cleanse your subconscious with the, the negative thoughts or the negative substances that you're carrying within you as a being. So this is a long process, and it does not happen in one sitting or two sessions. This is definitely going to take a while, because there are a lot of layers that everybody, even if you talk about a traditional visit to a shrink, takes a long time, where obviously it's called talk therapy, because the psychologist just talks to you and understands your problems. Here we do the intervention through art, which is a very indirect way, where people, are not very defensive. Sometimes in their defensiveness or in their defense mechanisms, people can, lose out on the focus of the entire treatment and go in various directions and not come back. So it is a the sole responsibility of the therapist to bring them back. Art therapy with visual art purely is a very indirect form of using an intervention, which is art, to cleanse your mind, and to also, it's called sublimation, where you are converting your negative energy into positive energy through the visual art as a intervention method or a modality. Art therapy session is very subtle. So it is, it is my call and it is my role to identify the issue, create a metaphor, and then make sure the metaphor is transferred to the patient or the client that I'm working with. So that could be like, there could be a wellness happening in the first metaphor, or it could be that the wellness may happen, in multiple metaphors. It could be that, many sessions it will take for a person to realize, to have the self-reflection, to have the self-awareness of what exactly is he facing, or is he going through mentally. Because a lot of people are only using their conscious mind, and they have not tapped into their subconscious at all, and they are not even aware of what is going on, what they have repressed, what they have regressed. And so those are the things that a therapist does typically when they meet you in the first few sessions, to analyze where exactly is the need and what exactly is the need. Now here I can give you an example of a sister who had given me a reference of her sister who was studying to be a surgeon. And this sister, the elder sister, was so worried that the younger sister has some issues. She is feeling stressed, and she's depressed. And then she came to me for a session, and during the session what I realized was that she was not having any issues. It was just that her exams were approaching, and she was trying to be a cardiac surgeon, and her education and the entire syllabus itself is very stressful. So she was only showing the symptoms of that stress. So to give you an example, what did she actually make in her artwork? She made a lot of microorganisms. She made a lot of microorganisms, which was a clue that she was only thinking, dreaming, sleeping about her masters, what she had gone to do. So there is no, that gives you a clue that there's nothing wrong with her. Essentially, she's only having a momentary stress related to her education. So people tend to jump to conclusions. Some people who are aware of it, And some people who have absolute no awareness think that, why should I go for even art therapy? Why should I go for even art therapy? I don't have anything wrong with me. So most of the times when people say that nothing is wrong with me, that is their denial or their defense, where they think that they can make themselves better, but their inner conflict is way higher than they actually realize. So it is not a very interesting situation to be there, because these are typically the patients who will take a lot more sessions than the people who are a little bit having awareness about themselves and are willing to get therapy done, because the willingness to become well is the beginning of being well.